If you've ever had to deal with really stubborn allergies, chances are you've come across levocetirizine. It's one of the most common second-generation antihistamines out there. But what actually makes it different from all the others? Well, in this explainer, we're going to break down the science behind this little pill, how it actually brings you relief, and why it's become such a go-to for so many people. So this is it. This small 5 milligram tablet is a real powerhouse. It's designed to stop all those frustrating allergy symptoms, the runny nose, the itchy hives, pretty much right in their tracks.
We're going to tackle this in 5 main parts. First, we'll get to know levocetirizine itself. Then we'll dive into the science of how it actually works. After that, we'll look at how it's used, check out its safety profile, and then we'll wrap it all up with the bottom line. How does it stack up?
Okay, so let's start at square one. What exactly is levocetirizine?
So the real key to understanding this drug is that term R-enantiomer. What on earth does that mean? Well, think of it this way. Its predecessor, cetirizine, is kind of like a mix of 2 molecules that are perfect mirror images of each other, like your left and right hands. It turns out only one of those hands is doing most of the heavy lifting. Levocetirizine is only that active, more effective part. It's basically the refined, purified version, which means you get maximum impact from a much smaller dose.
You've probably seen it sold under a bunch of different names, right? Xyzal, Levocet, Texine. But here's the thing. No matter what it says on the box, the active ingredient inside and how it works is exactly the same.
And this little chart shows you exactly where levocetirizine fits into the bigger picture. It's what we call a preferred second-generation antihistamine. So why preferred? Well, because unlike older antihistamines like Benadryl, this whole generation of drugs was specifically engineered to cause less drowsiness. You get all the allergy relief without feeling like you've been completely knocked out for the day.
So we know it's a refined, less drowsy antihistamine. But how does it actually stop an allergic reaction right at the source? Let's dive into the science.
It all really comes down to a simple lock and key idea. See, in your body, you have these things called H1 receptors, which act like tiny little locks. During an allergic reaction, a chemical called histamine acts as the key that fits into those locks. And when it turns, it causes all those symptoms we hate: the itching, the swelling, the runny nose. Levocetirizine is like sticking gum in the keyhole. It just blocks the receptor so histamine can't get in and trigger that reaction in the first place. So what happens once you take it? What's its journey through the body? Well, first, it gets absorbed really fast. Then it's distributed all over. But, and this is the super important part, it barely gets into the brain. That's a secret to why it's less sedating. After that, it's not really broken down by the liver. And finally, it's mostly passed out of the body, pretty much unchanged, through your kidneys.
And that right there, that whole journey explains everything. The fact that it stays out of the brain means you can actually function during the day. And the fact that it's cleared out by the kidneys means that anyone with kidney issues is going to need a different dose. The science directly tells us how to use it safely.
Which brings us perfectly to our next big question. How do doctors actually put this drug to use for patients?
The main targets are pretty clear. It's a go-to for allergic rhinitis, that's your classic hay fever. It's also used for something called chronic idiopathic urticaria, which is basically long-lasting hives. And of course, it's used for all kinds of seasonal allergies and even allergic conjunctivitis, super itchy eyes.
And the standard dose for adults is incredibly simple. It's just 5 milligrams once a day. A lot of doctors will recommend taking it at night, just to minimize any chance of even mild drowsiness during the day.
And here we are again, back at this really critical point, because your kidneys are doing all the hard work of getting this drug out of your system. Reducing the dose isn't just a good idea for patients with kidney problems, it is absolutely essential to avoid the drug building up to potentially toxic levels.
Okay, so we know it works well, but what about the safety side of things? Let's take a look at what you need to watch out for. When you look at the safety profile, there are really 2 sides to the coin. On one side, the most common side effects are pretty mild, a bit of drowsiness, maybe a dry mouth, or a headache. But on the other side, the main warning is serious. It is an absolute no-go for anyone with severe kidney failure, simply because their body has no way to clear the drug out.
Now, this is a big one. Even though levocetirizine itself is less sedating, if you mix it with alcohol or other things that slow down your brain, what we call CNS depressants, you can seriously amplify any drowsiness. That's why you have to be really careful, especially if you need to drive or operate any kind of machinery.
So what about for special populations? Well, it's generally considered safe during pregnancy, but only if it's clearly needed. And caution is also recommended for nursing mothers.
For elderly patients, it's really important to monitor their kidney function, again because of how the drug is cleared from the body.
All right, let's pull this all together. In our final section, we're going to look at the bottom line. How does levocetirizine really stack up?
The easiest way to really see its value is to put it head-to-head with its predecessor, cetirizine. Levocetirizine is just flat out more potent. You get the same powerful effect from a smaller 5 mg dose. And because it's only that pure active component we talked about earlier, it also has a lower risk of making you drowsy.
So, at the end of the day, its biggest advantage comes from its chemistry. By isolating just the active part of the molecule, scientists created a medicine that's both more powerful and easier for people to tolerate. It's really a perfect example of how small scientific refinements can lead to a much better tool for patients.
Which leaves us with one final thought. We've seen how levocetirizine gives us really potent, targeted relief with fewer side effects than the drugs that came before it. So, the big question is, with this level of refinement, have we hit the peak? Is this the final evolution for daily allergy relief? Or is there still another, even better generation of antihistamines just over the horizon?